Hello there, and welcome to another edition of Health Matters, a presentation by the Ministry of Health. Glad that you could be with us on today's program. My name is Nazim Hussain, and I've got with me Dr. Keisha Chin. She is a National STI Program Coordinator attached to the National AIDS Program Secretariat of the Ministry of Health. Welcome to our program, Dr. Chin.
Thanks for having me, Nazim.
Great. We know that World Hepatitis Day is being observed. But before we talk about hepatitis per se, let's talk a bit about the work of the National AIDS Program, especially for the year so far. Normally whenever viewers and people hear about the National AIDS Program, NAPS, it's about HIV, it's about AIDS, and sometimes nothing else, condoms and AIDS. But the National AIDS Program for many years have been beyond HIV and AIDS. Tell us a bit more.
Okay, so the National AIDS Program Secretariat has received a mandate set out to eliminate HIV/AIDS and other forms of sexually transmitted infections by the year 2030. We are actually guided, I'd like to refer to it as a roadmap of sorts. It's a document referred to as our HIV Strategic Plan, or HIV Vision 2025. And it basically, as I said, gives us a roadmap of ensuring that all the strategies and interventions that are necessary for us to take and work towards eliminating HIV/AIDS and other forms of sexually transmitted infections. And I actually like your question because indeed, a lot of persons, when they hear about the National AIDS Program Secretariat, they think it's simply doing work towards eliminating HIV or AIDS, but we also focus on the other forms of sexually transmitted infections. We are aware that HIV and AIDS has the greatest global burden in terms of sexually transmitted infections because HIV is a sexually transmitted infection. However, a lot of focus also has to be placed on other forms of sexually transmitted infections. So what we're doing as a national program is to highlight those other STIs and bring them to the forefront. Now, particularly important for persons to be aware of is that two things actually I would like them to be aware of. Persons who contract another form of sexually transmitted infections, especially if it's a repeat infection, if it's the same infection or other sexually transmitted infections, those persons are more susceptible to contracting HIV. That's one. The second thing is that if you have a person that is already living with HIV, who on top of that also contracts some other form of sexually transmitted infection at some point or the other, their transmissibility level for their HIV is also increased. So basically all of that is to say that there's no eliminating HIV/AIDS without also addressing and controlling the other forms of sexually transmitted infections. That is the message that the National AIDS Program Secretariat has been pushing. We are creating awareness for that, and we have included other STIs as a main focus as well alongside HIV and AIDS.
That's how it's done because in recent times we're hearing that you can, when you go to do an HIV test, you can also at the same time have another STI test done. Tell us about that one.
Okay, so that's actually part of our combination prevention services that we're actually offering. So just a little bit before I go into the testing aspect, HIV STI combination prevention, it includes not only testing for HIV and other forms of sexually transmitted infections, it also includes the aspect or the component of care and treatment. We also offer support, social support, or other forms of support to our clients or our patients. And we also have a particular focus on assisting our national elimination of mother-to-child transmission program. So those are basically the pillars or the elements that are involved in combination prevention. Now, to the question of the availability and accessibility to testing, for quite a few years, the general idea behind testing at our voluntary counseling testing sites, now referred to as our HIV STI testing sites, is that you go and you get screened for the STI that's of most concern to the general public, which is HIV. Now, it's not recent, but we are recently trying to ensure that the awareness has been optimized and expanded, that persons can go to a testing site or testing facility, and at the same time they can receive a rapid testing for HIV. They can also in most cases receive for syphilis, hepatitis B, and they can also be screened for other forms of sexually transmitted infections like syphilis, genital discharge syndromes like gonorrhea, chlamydia. They can also be even screened for hepatitis C, where a sample can be taken off and sent for further testing at one of our specialized laboratory facilities. So it's really to say that it's a one-stop shop sort of experience when you go for HIV STI screening currently in the country.
And when we look at it, HIV per se, and you were talking about raising awareness, is also trying to have people not contracting HIV, not contracting STIs. What are some of the new features we have at the National AIDS Program that is rolling out countrywide as it relates to prevention?
Okay, so before I actually mention the features, the reason that we would have, or the reason that we have quite a few new features or services coming out from the National AIDS Program Secretariat is that we are really looking to have differentiated services, meaning that we're tailoring our services and our products to meet the persons that are most in need, meaning the persons within our society or population that are most susceptible to contracting HIV or other forms of STI. So we're tailoring those services and products to get to them. So what are a few of those new services or products that we are currently offering? I'd like to first highlight PrEP, which stands for pre-exposure prophylaxis for HIV. So it's a medication, or a drug rather, that is being given to persons who are most susceptible to contracting HIV, in particular, persons that are most susceptible to contracting HIV. And once taken correctly, it has a 99% efficacy in terms of preventing a person from contracting HIV if they were to be exposed. Now, who are the persons within our population that can access PrEP services for HIV prevention? We're offering it with a particular focus on our key populations. So men who have sex with men, our female sex workers, persons from our transgender population, and also vulnerable groups. We're targeting prisoners, we're targeting migrants, we're targeting our minors and our loggers, but also persons from the wider or general population can also access PrEP services and PrEP medication once you're above the age of 13 and you would have been evaluated within the health facility and deemed to be PrEP eligible.
Here's where we take a break. When we come back, we'll continue talking with Dr. Chin a bit more on HIV prevention and, of course, talk about our main feature on today's program, hepatitis. Stay with us.
This is Ray. Ray is at a community screening where he is waiting for Doc, who tells him he has hepatitis and advises him to come to the health center for follow-up. What should Ray do? Ray skips his checkup and hangs out with his friends instead, and goes to work and everywhere else. In the fun and the hubbub, Ray forgets to go to the health center. Over time, he observes that he's been feeling sick. Worried, he sees Doc, who advises him to undergo further tests for liver disease and scan for liver cancer, with unfortunate results. Do you want to try again? What should Ray do? Ray goes to his health center for follow-up, where Doc conducts further tests to determine the state of Ray's liver. With his friends, he abstains from drinking alcohol, maintains an active lifestyle, and eats healthily. He also goes for regular checkup. He gets scanned for liver cancer. And it turns up clear. By maintaining a healthy lifestyle and seeing his doctor regularly, Ray remains healthy, with low risk of liver cancer.
Welcome back to our program. We're talking to Dr. Keisha Chin of the National AIDS Program Secretariat. We're talking about STIs. Dr. Chin, we're talking about HIV prevention. We just before the break, we spoke about PrEP. Another interesting feature as it relates directly to HIV, and something very unique. Self-testing. One would have never thought the day would come for any major health issue that you could actually do a self-test.
Correct. So it also ties in back to, it's one of our differentiated services or products that we are offering. So in terms of the HIV self-testing kits, the general population is aware that you can go to a health facility and you can have the blood drawn or the rapid testing for HIV. However, for the last 2 years, I think it is, that the National AIDS Program Secretariat has been offering free to the general population persons who choose to have a differentiated type of HIV testing. So we still have the blood drawn rapid test available, but the person can visit either the National AIDS Program Secretariat, or they can visit one of our HIV testing sites, or even within their community, one of the community health centers, and they can receive for free an HIV self-testing kit, which is also referred to as our oral quick kit. It is safe, it is reliable, and it also has a very high efficacy rate. It's 98 to 99% effective in terms of giving you the correct and reliable results that you're looking for. It's very simple to use, actually, and we've seen a great uptake in terms of the use of the HIV self-testing kit, because one of the benefits, or two of the benefits rather, it's that it allows persons to conduct a test in the privacy of their home, and it also allows them to conduct a test for themselves at their own convenience, and they can also uplift a maximum of 2 kits, one for themselves and one for their sexual partner as well.
As you know, in the middle of the year, health policy organizations would have charted a special day put aside for hepatitis, World Hepatitis Day. And that's the feature we want to discuss on our program today. Tell us a bit about hepatitis and how is the program, your program at the National AIDS Program Secretariat, work along with this particular STI, and why is it singled out on a global perspective?
Okay, so in terms of hepatitis, hepatitis refers to an inflammatory disease of the liver, and it's actually one of the leading causes of severe liver disease and hepatocellular cancer or liver cancer. Now, in terms of the statistics globally for hepatitis, it's one of the leading infections, sexually transmitted infections. And at the National AIDS Program Secretariat, we're most concerned about the 2 forms of viral hepatitis, which would be hepatitis B and hepatitis C. They're the most common forms of viral hepatitis, and they actually account for about 2.2 million new infections yearly. You have recorded of a combined Hep B and Hep C, and it also accounts for over 1 million liver disease related deaths per year. And in terms of locally here in Guyana, it's among our top 5 leading STIs that we're seeing. So because it's the leading cause of severe liver disease and liver cancer, we have done quite a few things. The Ministry of Health, through the National AIDS Program Secretariat, has taken quite a few initiatives. One would have been, and I love to highlight it, is that we're actually one of the first countries within the Caribbean to actually have a specific clinic, or a hepatitis C clinic, that is dedicated to not only looking at patients that are suffering from hepatitis C, but also suffering from chronic hepatitis B, because those are the 2 forms that can not only be acute, meaning early disease, but they can also go on to be in prolonged or chronic diseases. In terms of the hepatitis B, we do have available for free in Guyana the antiretroviral drugs or medications that are necessary to treat the chronic form or the prolonged form, because acute infection can be eliminated from the body, auto-eliminated, I like to say. However, a small percentage of persons will actually go on to having the chronic form of hepatitis B, which requires treatment. There's no cure, but we do have treatment to help persons that have prolonged or chronic Hep B to live healthy and productive lives. Now, in terms of hepatitis C, as I said, We do have a clinic here that is based out of the National Care and Treatment Center, which is also referred to as our NCTC clinic. And it's the leading sexually transmitted infections clinic for the country. Persons can be seen there. They are evaluated by our specialist clinicians, and they are given treatment. And we're actually seeing a 95 to 98% curation rate with the treatment that we have available here in Guyana, and it's in keeping with what we're seeing coming out from first world countries as well. So we're pretty excited about that.
You talk about hepatitis being a sexually transmitted infection. We know with HIV and AIDS, there are other modes of transmission. With hepatitis, are there other modes of transmission, or is just sexually transmitted?
So for types B and C, they can be transmitted through sexual contact if you were exposed through unprotected sexual activity. However, there's the parenteral route as well, and for persons who do injectable drugs as well. So what are the target, or what are the groups of the population that are most susceptible based on those modes of transmission? You would have persons who engage in risky sexual behaviors or lifestyles, persons who use injectable drugs, especially sharing needles, and also our healthcare providers are at risk. So we're really targeting those populations to increase our awareness among those populations. We do constant screening and health promotion activities to have persons tested, so that if you're detected and you're early, we can evaluate you to decide if you have early stage or acute infection. And for persons that have prolonged or chronic infection that require treatment, we can have you be placed on those treatment, or the treatment, as early as possible, so as to prevent any further health complication.
Well, what happens to a person who does not know that they're infected? Just walk us through a bit what will happen to that person.
So some of the common symptoms of a person that has chronic disease may experience are predominantly gastrointestinal symptoms. So a person may experience vomits, nausea that may lead to vomit rather. A person may experience some amount of abdominal discomfort, abdominal distension. They may have a few episodes of diarrheal cases. Some other non-gastrointestinal symptoms that patients may also experience. You have a lot of persons that may experience fever, and I think one of the most telling signs would be a person who becomes jaundice, or seeing that yellow discoloration to their skin or mucus lining as well. And basically, those are the most common symptoms that a person would experience if they have prolonged disease. And then with further testing, we can do imaging to see if there has been changes to the liver, etc., which would indicate to us that it's a prolonged disease, or chronic disease rather, and you have experienced changes to the liver that would require further medical intervention.
And so, the National AIDS program and the health facilities around our country has the capacity not only to test for HIV and other forms or other STIs, but also can someone turn up at most of the health centers and get and ask for an hepatitis test?
Yes, so we do have the service that is, I want to say, more specialized or focused in terms of testing at our various HIV and STI testing facilities. But you can go to any of your community health centers or the health centers within your area, even at some of our hospital outpatient departments, and you can express to the clinician or the healthcare worker that you're interested in being screened for either hepatitis B or hepatitis C. And within the public system, that can also be done for you for free.
So someone's going to ask now, so I've gone there, I've been tested positive for hepatitis, let's say C. What happens afterwards?
So our referral system actually kicks in. So you can be evaluated, whether it's imaging done for you. We can either do an ultrasound, or in some cases, if necessary, a CT scan can be ordered to see if you've had changes to the liver, or what damage has been done to the liver already because of your chronic infection. You can also have blood drawn for other testing done. So we do your liver function test, and you can also have more general type of blood tests or screening done for you. So as we can get a more holistic picture of what is really going on with you and what interventions are necessary. Based on what those results are, as I said, a referral system then kicks in and you can be referred to our primary hepatitis C clinic, where you're seen by trained and specialized physicians, and you're given treatment and you're followed in the clinic to see how well you do based on the treatment that you would have received, or how well you're responding to treatment and what other interventions are necessary.
And of course, treatment will vary from if early detection is made or if late detection is made, if the liver is severely compromised. So do we have access to treatment across those spectrum?
So the treatment that is available currently, it's a standard treatment that we have. It's evidence-based and it's keeping with international best practice. So basically, it's treatment that you would get if you visit any first world country or even other countries within our Caribbean region. Now, the thing about it is that the management of that patient would vary depending on the severity of the case, even though the medication remains the same, specifically for the hepatitis C infection. However, what you would find, depending on the severity of the case, you may have other medications that may become necessary, and you may have changes or variations in the management of that patient based on their clinical presentation at the time that they're detected.
We're speaking to Dr. Keisha Chin. She is the National STI Program Coordinator at the NAPS. Stay with us. We'll be right back. Welcome back to our program. Dr. Chin, so we've got this day, and the theme is
Time for action.
Time for action. So the team of NAPS will be in action. Tell us a bit what's going to be happening to observe World Hepatitis Day.
So we're actually increasing awareness via our various social media platforms. We're having multimedia platforms where we go on and we do health promotion. And we bring awareness to what is hepatitis, what are the dangers of not being screened and having early detection or not properly treating hepatitis B or hepatitis C in terms of addressing it as the leading cause of severe liver disease or liver cancer. And we're also increasing our presence within the community as usual. Now, the general public is accustomed to, as I said, us bringing these services into the community. You can still visit the various health facilities, but we want to come and bring these services to you. So for Hepatitis Week particularly, from Sunday we are going to kick off having activities, whether it's at the KTC Wall, at the Perica Market. We are looking to go into some other very hot spots, we like to refer to them as, where we can have, you know, a wide range of our target population and offer not only screening and testing for hepatitis B or hepatitis C, but as I said before, we want to make it very holistic and we want to do HIV, STI combination prevention. So even though we're focusing on hepatitis, we're also still offering other screening, particularly screening for HIV. And we're also going to include other services to make it even more holistic. So persons can access the PrEP medication that I would have spoken to earlier. They can also access our lash bag. So that's
Tell us a bit
something,
about that.
yeah, so it's actually, the official name for that bag is actually our PrEP for Sex bag. But over a few months ago, we would have actually done a social media competition where we would have asked persons to come up with a name to coin the PrEP for Sex bag that they would feel comfortable referring to it as, and it would make it easier for them to understand what is actually in the bag or what we're actually trying to do with the bag. And the name that one was actually the lash bag. So what is included in the lash bag? it can have, it actually includes an HIV self-testing kit that we would have spoken about earlier. It also includes free condoms, free lubricants. It includes some of our IEC materials, so pamphlets or brochures. The back can also include an STI booklet where you can see images and read a bit on the write-up about the various forms of sexually transmitted infections, what they look like, what are the common symptoms, how you can prevent them. And there is a variation of the bag that can also have the PrEP medication inside, which, as I said before, it's pre-exposure prophylaxis for HIV prevention. So we're going to be out in the community.
And off camera, we're talking about there's another service, NPEP.
So there's also NPEP, which stands for post-exposure prophylaxis. So the PrEP is prior to a person being possibly exposed to HIV. If they take that medication, it prevents them from contracting HIV once taken correctly. We also have a medication which is post-exposure prophylaxis, that if you would have already been possibly exposed to HIV and you visit a health facility within no less or no more than 3 days of being exposed to or possibly exposed to HIV, you can be evaluated and you can be screened and placed on post-exposure prophylaxis, which also prevents you from developing HIV.
Dr. Chin, thanks a lot for being on our program. We've been talking to Dr. Keisha Chin. She is the National Program, STI Program Coordinator at the NAPS, talking about STIs, especially hepatitis, as we observe World Hepatitis Day with the theme Time for Action, and the NAPS team will be out there all of next week talking and bringing awareness and doing testing for hepatitis and other STIs. I'm Nazim Hussain, thanking you for being with us on today's program. Until we meet again next time, stay safe.